All right. Hello, everyone. This is Dr. Mimi Tan. This is another weight loss and bariatric surgery live seminar. Thanks for joining in today. So really briefly, we're going to go over kind of a couple weight loss and treatments and bariatric surgery treatment options during this talk today. That whole talk should take about 20 minutes. And then after that point, we'll move on and do our live Q&A session. So if at any point you do have questions for me about any of the topics that we're covering today, feel free to either put it directly into the YouTube chat below, or if it's easier for you, feel free to text us at this phone number here. This number will stay up during the course of this entire talk. So let's get started. All right, so is weight loss hard? This is, I wanted to start this session out with this question. I think it's a very, very important question. And it might seem silly, but we'll talk about why I think it's important, the context of this discussion. The reason why it's so important is because we as a society have actually answered this question wrong. We have answered this question saying that actually, no, I don't think weight loss is that hard. Weight loss should be easy. All you have to do is eat a little less, exercise a little bit more. Maybe if you had a little bit more self control, things should just happen pretty easily, right? We've all heard this so many times. I mean, I hear this every single day as a bariatric surgeon. And if you are here today, I want to applaud you because you have heard this same thing. You've heard this every single day. And you have paused and said to yourself, actually, no, I think all these people, what they're saying is wrong because weight loss is incredibly, incredibly hard. That has not been my experience. And what can I do to get some help? What more can I do other than what I'm doing already? And I will tell you why you are right. This is a graph from the CDC, and it is a graph over about 50 years of weight data for the US population. Each of these lines represents a group or a class of BMI. Now, for those of you who are unfamiliar, BMI is a ratio of your height and your weight. And we use it in medicine and in obesity medicine to understand how likely your weight is going to impact your health, either currently or in your future. Now, it's certainly not perfect. There's a lot of very valid criticisms of BMI, but it is the tool that we most frequently use. Now, based on your BMI, we have different categories, either normal weight, overweight, and obese. And then within obesity, there's several classes of obesity as well. Now, what I think there are two important things to notice about this graph. The first is noticing that obesity rates in the US have been steadily climbing over the last 50 years. The most recent data from this graph is from 2017 to 2018. And as of 2017, over 40% of the US population is in that obese category, and almost 40% of the US population is considered in that overweight category. So what that tells me is that there's about 80% of the US population that is either overweight or obese. And again, BMI is not perfect, but what this tells me is that most US people, adults in the US, are struggling with their weight to some degree. This graph only exists because weight loss is incredibly hard. This trend would not exist if weight loss was just an easy thing that we could all do. So why is weight loss so hard? And that's a million-dollar question. And why it's so complicated as a question is because there are so many different factors that go into A, how much you weigh, and B, how hard it is for you to lose weight. Some of these things are within your control, right? Your diet, what you eat every day, you do have some control over to some degree. How much you exercise, you have some control over as well. What your support system, you have some control over that too. The one thing that you have little to no control over is your biology, right? Who your parents are, what your genetics are, what your body chemistry looks like. That's going to be a little bit different for every single person, and that it makes a huge impact in terms of how much you weigh currently and how hard it is for you to lose weight. Okay. And so for people who have tried losing weight over and over and over again, and this is a very common thing for patients that I see, they've tried every diet under the sun, and maybe they've had some success with some of those plans, but they haven't been able to keep the weight off. What I tell these patients, what I want to tell you, is that weight loss failure is not a moral failing. It's not because you didn't try hard enough. It's not because you needed to put a little bit more effort in, or that you needed to have a little bit more self-control. It's a failure against your biology. It's a failure against something that you kind of were born with and that you have right now, and you don't have any easy control over, right? And I say easy control over because at the end of the day, you do have some control over these things. And this talk, I want you to feel like empowered, that you can take control back over your life. What I hear a lot from my patients is, well, I've been struggling with weight all my life, or there was an X point in my life where I started to gain weight and things just started to snowball and I feel out of control. I can't get things back to where they used to be, right? No matter what I'm trying. And so I think control is super key, and these are some tools that are going to allow you to take back control of your life. And we'll talk about each of these a little bit more in detail, but to summarize them, and I'm going to talk about them from least effective to most effective, they're going to be lifestyle changes, so diet and exercise, weight loss medications, and then bariatric procedures. All right. Okay, so let's talk about diet and exercise first. Diet and exercise, this is going to be the least effective tool for weight loss when used alone. Depending on how much weight you want to lose. If you want to lose a substantial amount of weight, maybe 40 plus pounds, and you want to keep that weight off, the success rate of actually being able to do that with diet and exercise alone is extremely low. It's probably around 3 to 5%. And maybe you might have a little bit more success if you're medically supervised, meaning you have a nutritionist or you have a physician who's kind of monitoring you through that process, but that doesn't increase that chance of success by very much. Now, I want to emphasize that diet and exercise is absolutely foundational. Even though it's not very effective by itself, it is absolutely crucial for anyone who is trying to lose weight. These tools that we're going to talk about later, the medications and the surgery aspect of things, those are great tools, but if the diet, especially the diet piece, if the diet piece is not, if you're not following the correct diet, if you're not eating in a healthy way, it's still going to be very, very difficult to lose weight. So you do still have to put the difficult work in to make those lifestyle changes. Now let's talk about medications next. This is a super hot topic right now, so we'll talk about it briefly. Broadly speaking, there are two classes of medications that are available. There are the oral medications that you take by mouth, so it's either a pill or a capsule. You take a pill usually once a day. And then there are the injectable medications. These are medications, these are some of the newer medications that you're hearing about in the news or social media. They're in that family of medications that fall under Ozempic. And these injectable medications, they're very exciting because they are a little bit more effective than the oral medications that we've had for a longer period of time. Most of these medications, it's a one-time use injection, and you inject it into your arm or leg, and it's usually once a week. There are some that are where you have to do it more than that. Broadly speaking, again, both of either the oral medications or these newer medications, they kind of work usually in one of two different ways. One is that they might work on your brain and they might help suppress appetite. And they make choosing healthy choices and making the right diet and lifestyle choices a little bit easier for people. The other way some of these newer injectable medications work is they also slow down your gastric emptying, meaning they slow down how quickly food moves through your stomach. What that means for you is that it makes you fuller faster, and it makes you fuller for a longer period of time after a meal. Now, the pros and cons of each of these medications. So non-injectable weight loss medications are going to be a little bit less effective. Expected weight loss with those medications usually fall around 5 to 10%. The injectable medications are a little bit more effective, like we talked about. It'll be about a 10 to 15% weight loss. These medications are all going to have their unique side effects. And I think that's it's both a pro and a con, because each of these medications are unique and they're different, and each patient is unique and different. We can certainly kind of try different medications and see what works best for you. One big concern right now, especially with these newer injectable medications, is that they can be very expensive and they can be very difficult to get a hold of. There are some insurances that are currently covering these medications, but if you are not covered or if you're undercovered, they can be prohibitively expensive actually for most people. One common question that I get is, what about the long-term durability of these medications? Do I have to take them for the rest of my life? What we do tend to see with these medications is that when you stop taking them, the weight loss either stops, and we do tend to see weight regain after these medications are stopped as well. So generally speaking, when we start these medications, the idea is that we want you to continue those long term. Now, I do have patients who come to me saying, well, I've had success with my medication and I want to try coming off of them. I support you in doing that if you want to do that, but what I recommend is doing it in a way that's controlled, having me involved or having a provider involved in that process, to make sure that you are not falling back, or you're not kind of reversing some of the hard work that you've already done. All right. So let's talk about bariatric surgery. This is my favorite topic. I'm a bariatric surgeon. This is going to be the most effective tool for weight loss. Typically, on average, we're going to see about a 25 to 30% weight loss, meaning if you currently weigh 200 pounds, you can expect to lose about 50 to 60 pounds, again, on average with one of these surgeries. On top of just the weight loss, I think really one of the greatest parts of bariatric surgery is that it also addresses the diseases that are related to being overweight or being obese. So these are health conditions like diabetes, high blood pressure, sleep apnea, high cholesterol. These are all going to improve with bariatric surgery, and sometimes they can actually be cured with bariatric surgery. On top of that, we also know that you're at a lower risk for heart attacks, lower risk for strokes, you're at lower risk for over a dozen cancers after bariatric surgery. And so these are really the big things that I emphasize to my patients. The weight loss is great, but it's also great for your health as well. Who qualifies for bariatric surgery? This is a little bit of a complicated question right now. And it's complicated because the guidelines for bariatric surgery recently were updated. The old guidelines, these are the guidelines that insurance companies still use, is that you have to have a BMI of greater than 40, or you have to have a BMI of greater than 35 with some of the diseases that we talked about that are related to being overweight or obese. Now, last year, major medical societies decided as a group that actually a lot more people could benefit from bariatric surgery. And so they lowered some of those guidelines that they're recommending right now. And so currently anyone over a BMI of 35 or anyone with a BMI of greater than 30 with diseases related to being overweight should consider bariatric surgery. Unfortunately, until insurance starts covering those guidelines, it's a little bit difficult for most people to be able to follow those guidelines. So if you do have questions about how bariatric surgery might fit into your life, I would recommend talking about it with your doctor. Okay. Let's talk a little bit about what bariatric surgery looks like for people. Bariatric surgery is done minimally invasively. Today, at pretty much anywhere you would go, you're going to get minimally invasive surgery with bariatric surgery. And what I mean by minimally invasive is this is in contrast to open surgery, which would mean a big incision starting from your chest bone down to your belly button, and then doing the surgery through that big incision. Minimally invasive surgery is either going to be done laparoscopically or robotically. And what we do during surgery is make several small incisions, the biggest one being less than like an inch in size. And we use instruments through those incisions. We put a camera in through those incisions and we operate that way. As you can imagine, minimally invasive surgery has really drastically improved the safety of bariatric surgery, and it's really drastically improved the pain and recovery time that people have after bariatric surgery as well. Now, the most common bariatric surgeries that we do today, the top two are going to be the laparoscopic sleeve gastrectomy and the gastric bypass. The gastric bypass we've been doing for a very, very long time. It's the oldest bariatric surgery that's out there. And what we do with the gastric bypass is we turn your stomach into a very small pouch, about the size of an egg. And then we bypass the rest of that stomach and then the first portion of the small intestine. And by doing that, what we're doing is we're limiting how much food goes into your stomach, and then we're also limiting how much food gets absorbed. So it kind of works two different ways. The sleeve gastrectomy, on the other hand, what we're doing with that is we're taking out most of the stomach. About 80% of the stomach is removed with a sleeve gastrectomy, and we leave you with a thin banana-shaped stomach. That banana-shaped stomach is going to, again, limit how much food you can eat at one time, but there is no limiting of absorption necessarily in your small intestine. Now, comparing the two, the sleeve gastrectomy tends to have a slightly safer risk profile, meaning generally speaking, we see fewer complications with the sleeve gastrectomy. Both of these surgeries have low risks overall, but the sleeve is a little bit safer. Sleeve also is a little bit, it takes about an hour to do versus the gastric bypass, which takes about 2 to 3 hours to do on average. And both with the sleeve gastrectomy, most of our patients are actually going to go home the same day. The gastric bypass, you typically do stay with us at least one night before going home the next day. All right. The gastric bypass, you tend to see some more vitamin deficiencies as well than the sleeve gastrectomy, but both can be well controlled with if you take your vitamins for the rest of your life. All right. Obviously, during your consult, we would go into a lot more detail about the sleeve versus the gastric bypass. For some patients, one might be a better option than the other. For a lot of patients, both of these surgeries are going to be great options, and we can go into a little bit more detail about what the pros and cons are with each of these surgeries. Now, I also want to talk a little bit about the endo sleeve. This is a newer procedure that we have in our toolkit, and it doesn't fully fall into the surgery category, and I'll explain why. The endo sleeve, or the endoscopic sleeve gastroplasty, you might hear it as the ESG for short. This is a procedure where we go in with a long, thin camera, and we go in through your mouth, which goes into your esophagus, and then it goes finally into your stomach. And using that camera and a device that attaches to the camera, we're actually able to throw in sutures internally into your stomach. And we throw these sutures in a way where it scrunches up your stomach and it limits the size internally of your stomach. And so it's simulating what happens internally with a sleeve gastrectomy without actually removing any stomach. And the really nice thing with this is that it is not a surgery, meaning we don't make incisions during this procedure. And so as you can imagine with the endo sleeve, the recovery time is much more rapid for our patients as well. Now, the weight loss, this is relatively new, so we don't have a lot of long-term data about the endo sleeve, but weight loss results at a year are pretty good. They're around 20% to 25% with the endo sleeve. So it's a very exciting option for our patients to have as well. All right, really briefly, I want to talk about two of the most common bariatric surgery myths or misconceptions that I hear about almost every day. The first one is that bariatric surgery is so extreme. I hear about this most from people, from patients as like family members and from their friends and family. And I totally understand where this is coming from. Bariatric surgery can seem extreme in the sense that most of us are not lining up for surgery for no reason. Now, what I do want to emphasize is, yes, bariatric surgery is surgery. We are going to put you to sleep. we're going to make incisions. But bariatric surgery is extremely, extremely safe. In the if we go to a hospital today and look at a list of all the procedures or surgeries that are being done that day, bariatric surgery is going to be actually one of the safest surgeries that are on that list. It is comparable to your gallbladder being removed in terms of overall risk that is being associated with that. And what I like to tell patients is to think about, yes, you're taking on some risk. There is, of course, some risk for complication with your bariatric surgery now, but the idea is that you're preventing much worse risks down the road. And so that you're preventing things from happening in the future. Okay, you're taking on a small risk now to save you from larger risks in the future. The other big misconception that I hear about bariatric surgery is that bariatric surgery is the easy way out. And I'm changing actually my thought process about this a little bit. In that, one, my patients all work every single day after surgery to lose weight and maintain their weight. There's nothing particularly easy about bariatric surgery, right? There's a lot of challenges that you still have to go through. It's a huge lifestyle change. But what I really want to emphasize is that bariatric surgery is a tool. Yes, it makes your life easier. It makes losing weight easier. So in some ways, you can consider it maybe the easy way out if you want to think about it like that. But anytime we have something that is challenging to do, maybe even impossible to do, most of us are going to go reach for a tool to try to help themselves accomplish that task, right? Every other day, I vacuum my floors, and no one is judging me for using a tool to clean my floors, right? Bariatric surgery or medications, all these tools that we talked about, we should be thinking about it the same way, right? It is a tool to help you with something that is very, very challenging. All right, so this is a chart that summarizes essentially everything that we talked about in terms of the different options for weight loss. This is a great screen to kind of screenshot or save for future reference. What is Aviva? This is our medical group. We are located in Shoreline, Washington, which is just a little bit north of Seattle. And that's only important for you if you are having bariatric surgery with us. Then you would come to our location and we would do surgery here. For all of your other visits, if you would like, you can have telehealth visits with us. We can do everything virtually. I love seeing my patients in person if possible, but I totally understand that driving in Seattle is not easy and that we all have very, very busy lives. So we see most of our patients virtually. Who is Aviva? I think is actually the much more important question than what is Aviva. And I think this also goes beyond just your surgery team. Obviously, your surgeon and the surgery team is incredibly important on your day of surgery. But I think what is even more important is who are the people who are supporting you up to the point of surgery and who's going to be supporting you after surgery. And we have a wonderful team of PAs, nutritionists, we have medical assistants, we have coordinators, everyone who is going to try to make this process for you as approachable and easy as possible. Nothing about preparing for bariatric surgery and nothing about the post-operative kind of recovery from bariatric surgery is necessarily easy, but we try to support you as much as possible through that. And that is incredibly, incredibly important for success. After bariatric surgery, what you want to make sure is that you have a team who is not only be able to give you this tool, so give you a surgery or give you a medication, you want a team who is going to be able to support you long term and teach you how to use that tool correctly, how to maintain that tool correctly to maximize your success. All right. So how can you schedule an appointment with us? If you're interested, you can go to our website, avivamd.com, click on the Contact Us link, fill out the form, and then we will get a hold of you and schedule you for an appointment. All right, so that ends our seminar portion of this talk, and we'll move on to questions. Taking a look at what we have now. I have nothing in the live chat. Let's see if there's anything that's been texted in. Can you talk a little bit more about deficiencies after surgery? That is a great question. And vitamin deficiencies or vitamin levels before surgery and after surgery are incredibly important when it comes to bariatric surgery. As you can imagine, with some of the surgeries that we've described, we're decreasing to some degree how you're able to absorb food, right? Even with a sleeve gastrectomy, even though we're just removing part of your stomach, that stomach still plays a role in absorbing vitamins and nutrition. And so we're taking out a large part of that. And what we do know is that long term after bariatric surgery, particularly with the gastric bypass, our patients can develop vitamin deficiencies over time. And so for that reason, it is incredibly important for us to check in on your levels frequently and also make sure that you are taking your vitamins. After bariatric surgery, you are going to have to take vitamins for the rest of your life. And that is just to help, again, support your nutrition, support your vitamin levels after surgery. Now, do you need to be super worried about being malnourished or having chronically low vitamin levels? I would say for the most part, no. As long as you are following up with us routinely after your surgery, you're taking your vitamins as you're instructed, we can stay on top of vitamin deficiencies that might come up. These are all things that we can manage over time. Is it something that we have to manage? Yes, we do have to manage it, but it's something that's very manageable, again, as long as you're following up with us after surgery. All right. Okay, let's see what else. Is there anything I can't eat after bariatric surgery? That is a great question, and I think this is a huge concern for a lot of people. How much is my life going to change after bariatric surgery? Are there things that I'm never going to be able to tolerate or never be able to eat again? And the short answer to this is there is nothing that I tell my patients you absolutely cannot eat after bariatric surgery. Now, immediately after bariatric surgery, we do have a lot of rules. We do have a very, very specific diet that we want to keep you on, and we have a specific schedule that we keep you on when it comes to that diet after bariatric surgery. And the reason why we do that is we want to keep your surgery safe. We want to keep your new stomach anatomy safe while your body and your stomach is healing after bariatric surgery. So during that time, yes, we have a lot of rules. There are a lot of things that you can do, that you can't do, that we'll tell you about at your consult and after your consult and after your surgery. But after you're done with that period of time, again, I don't tell my patients that there's nothing that I don't tell my patients there's anything you absolutely cannot eat. Are there general rules about what things are good to eat, what's not good to eat? Absolutely. But I think moderation is key with a lot of this, and there's nothing that I would say you absolutely have to stay away from. All right. There are some things I would say that some people have a hard time tolerating after bariatric surgery, and there are some things that people just don't enjoy after bariatric surgery that maybe they did enjoy before surgery. And so that's kind of, that might happen, but it's, again, we don't have any rules against anything per se. All right. Okay. I think that is everything that we have today. All right. Well, thank you so much to everyone who has tuned in today. Again, if you have any questions that come up in the meantime, feel free to comment in the video below and we can answer it at a later time. We monitor all those questions. And again, thanks for tuning in. Goodbye.